A man living in Hong Kong is believed to have been reinfected with COVID-19. The man is 33 years old, according to the new medical study by the University of Hong Kong. A clinical professor who was part of that study says the findings underscore the importance of vaccines and social distancing. He adds a second or third infection is likely to be less severe than the first, but can still be passed on to others. Let's get more insights on this story. And joining us now on The Final Word is infectious disease expert, Dr. Edsel Salvaña. Doctor, thank you so much for joining us. This clinical study from Hong Kong, is this a cause for concern?
Yeah, good evening, Rico. Good evening to everyone. Yeah, I think we need to look at the actual case report, which I understand is going to be published in a peer-reviewed scientific journal very shortly. But this can happen. We know people get colds several times in their lives, and we also know that the immunity to the virus can wane after a few months. However, the good news is it sounds like the second infection in this particular person was asymptomatic, which means that the antibodies that were generated by the first infection may have been able to neutralize the virus. It's just that there might have been still enough virus that was detected by the second test.
Dr. Salvaña, this clinical study also states that a second or third infection is likely to be less severe, but can still be passed on to others. So the question now here is, what if others get infected? How severe could it be?
Well, if it's their first infection, again, there are lots of factors that affect the severity of infection, your age, whether you have other illnesses. So that is probably the most important factor there. As for being infectious, again, it also depends on the person. If your antibody response is really, really strong, it might actually neutralize all the virus. So it's still too early to draw some conclusions, but we do know that people do develop immunity against the virus.
But in your view, doctor, are these reinfections happening already in our country without us knowing it?
They could be. It's very difficult, though, if they're not getting sick, so we're not going to detect them. And there are other reasons why it might look like a reinfection, but it might just be a relapse, or the first test, which was asymptomatic, might have been a false positive test. So many, many reasons. And so it's very, very important that we look at the hard scientific evidence before we draw conclusions, so that we'll come up with the right actions afterwards.
But if the immunity to the virus, as you mentioned, can also be short-lived, does this also raise questions about vaccines against COVID-19?
Well, it depends. Like, for instance, for influenza, we know that immunity against influenza is short-lived. So what people do is they get a yearly influenza shot. There could be boosters. It may also mean that people who've had the disease once may still actually need a vaccine at least once to boost the immunity. So lots of unanswered questions, but the fact that there are antibodies being generated, and we know that a lot of people are actually getting better on their own, have mild disease, makes me optimistic that the vaccines will probably work when we get them.
What about the issue of mutations? There were developments that took place in Quezon City. How serious is this?
Well, we know that the specific mutation here is the D614G, which has been spreading throughout the world. It's actually almost completely replaced the old D614 variant. We now call this new one the G variant. The evidence shows that this might be more transmissible, but it's not more deadly. It's about at the same level, or might even be less deadly, but we don't have hard evidence of that at this point. So the important action point here is, because we know that it might be more transmissible, we have to double up on our efforts to wear masks, eye protection, face shields, as well as physical distancing.
And briefly, Doctor, before we let you go, Metro Manila is now under GCQ, so more people are out and about in the malls, working in their offices. How often should they have themselves tested? And should it be antibody? Should it be antigen? Or should it be a PCR test?
Right. I mean, we don't recommend routine testing unless somebody actually does have symptoms. There are exceptions. People on the front line, sometimes we do test for surveillance. But these tests should actually be backed up by good prevention measures, a safe workplace. The test is just one of the tools that we use to detect the virus and to be able to respond to these surges. So I think it's a multifactorial response. Hopefully everyone will cooperate. But we do have the tools to beat this virus, so we just have to keep at it.
Thank you so much for joining us, infectious disease expert, Dr. Edsel Salvaña.